The nasal septum separates the left and right airways in the nose, dividing the two nostrils. It is depressed by the depressor septa nasi muscle. Structure. The fleshy external end of the nasal septum is sometimes also called columella. The nasal septum contains bone and hyaline cartilage. The nasal septum is composed of 5 structures: perpendicular plate of ethmoid bone, vomer bone, septal nasal cartilage, crest of the maxillary bone, crest of the palatine bone. Development. At an early period, the septum of the nose consists of a plate of cartilage, the ethmovomerine cartilage. The posterior-superior part of this cartilage is ossified to form the perpendicular plate of the ethmoid. Its antero-inferior portion persists as the septal cartilage, while the vomer is ossified in the membrane covering its posterior-inferior part. 2 ossification centers, one on either side of the middle line, appear about the 8th week of fetal life in this part of the membrane, and hence the vomer consists primarily of 2 lamellae. About the 3rd month these unite below, and thus a deep groove is formed in which the cartilage is lodged. As growth proceeds, the union of the lamellae extends upward and forward, and at the same time the intervening plate of cartilage undergoes absorption. By the onset of puberty, the lamellae are almost completely united to form a median plate, but evidence of the bilaminar origin of the bone is seen in the everted alley of its upper border and the groove on its anterior margin. Clinical significance. The nasal septum can depart from the center line of the nose in a condition that is known as a deviated septum caused by trauma. However, it is normal to have a slight deviation to one side. The septum generally stays in the midline until about the age of 7, at which point it will frequently deviate to the right. A perforated nasal septum can be caused by an ulcer, trauma due to an inserted object, long-term exposure to welding fumes, or cocaine use. There is a procedure that can be of help to those suffering from perforated septum. A silicone button can be inserted in the hole to close the open sore. An operation to the nasal septum is known as a septoplasty. The nasal septum can be affected by both benign and malignant tumors. Cosmetic procedures. The inferior part of the nasal septum can be pierced, usually through the soft tissue, but the piercing can also transverse the cartilage of the septum. Additional images. Horizontal section of nasal and orbital cavities. Left orbicularis oculi, seen from behind. Cartilages of the nose, seen from below. Coronal section of nasal cavities. Front of nasal part of pharynx, as seen with the laryngoscope. MRI image showing nasal septum. MRI image showing deviated septum.